if you had to look 12 months into the future, and let's say we were having this conversation 12 months from today, what secret sauce would vendors need to be focused on to assist you as a partner from your program being good to great? Neil, maybe start with you on that question.
Yeah, so I think I think the biggest thing is for us, the secret sauce is, making sure that it's part of the operational workflow, that it's not something outside, that it's really, built into the workflow, so that it's patients getting the appropriate care, getting the appropriate language, making sure that the staff understand the utilization for it, understand that it's patient safety, it's reputation, it's everything kind of going all into it. And I think making sure that it's built into the workflow and not just added on top of the workflow is really the biggest thing when you're looking at a local level of what the necessity is, for changes or growth in 12 months.
Yeah. Amanda, what about from your eyes?
I could not agree more with Neil, and I'll actually add it this way. What I've seen in over the years, and whether this was on the access side or here, especially on the language side, we've built language as just a bolt-on scenario, and we just add features as they come along. And it's time for us to reboot and rebuild access a language as part of the full solution of the DNA of the organization. So whether it's the workflow being part of Epic or whatever EMR that you use, we need to rewire language to be part of that full workflow. So Epic feeding into the workflows, feeding into regulations and how it builds in, feeding to how people are getting dispatched, feeding to the data, feeding to the predictive way and how we actually dispatch, feeding into how AI plays into this thing. And Neil kind of talked about that in the future. I think LSPs need to be talking through how do we do responsibly launch AI and shaping the language of how AI feeds into interpreting. We know about the translation piece of it and how that has been regulated, but we need to start talking through how all that works through. Now, the vendor that actually succeeds in this 5 years down the road is the vendor that will be able to stitch all this stuff together and be able to stitch it with the work of organizations like Epic to be able to say, I actually understand this very well, that I can actually come in and be part of that same DNA, so that I'm not just a bolt on, or I'm not just bringing in an iPad with my app, but my
Right.
app actually connects with the whole DNA and it's just a click through and everything just works seamlessly. That to me will be a blessing of a vendor that works with Epic, that works with the workflow. And for me, then it's just a matter of us, of the solution working internally. It also helps me with the documentation of interpreting. It helps me with understanding how all my patients getting serviced appropriately without me having to do piecemeal. And that's what I'm doing today. 5 years from now, I'm hoping that that will be all stitched together.
Hey man, you talked about the vendor that figures this out. I'm curious if you were to cast some thoughts to the supplier space or vendor space, on what doesn't exist today that we should be thinking about as a provider, as a partner. I know we've had some conversations about this. I know we've talked about AI. There's lots going on with AI. I'm curious your perspective, and then Neil, maybe I'll ask you the same question from Metro West lens.
I think there are a couple of things. One is the consulting aspect of it. I think you guys are really good at selling rates. You're really good at selling the products you have, translations, interpreting. You're good at selling that, but the part I think the industry as a whole has not been able to sell is the whole package of I am actually a language expert. I can actually come and talk about language and help you set up a program around language. I think if you guys can sell the whole program of language, I really think you as a package, and rates and everything else coming along with it, I think you'll be in good shape. Number two, and that connects to the understanding of how legislation plays in through different places. I think you guys can play in and become some level of an expert on that. The second part around it is AI.
Mm.
and building what AI really shapes up to. I think there are quite a few people who are trying to play around with it. It's an expensive piece to do, but I really think the person who figures it out, especially for healthcare, is gonna be able to shape that out. The third missing piece is who gets a relationship with organizations like Epic. That
Mm.
relationship with Epic, I think, is seems to be the elusive piece. I think
Yeah.
Epic allows for connections, but it's who can actually build that trust factor with Epic that connects us, you guys, and Epic. That connection is going to be a true trust factor, and I think that there's a race to it, but I'm not sure who's going to get there first. Um, I think quite a few vendors understand healthcare, but I'm not sure everyone understands it to the depths of maybe two specific vendors.
Mm.
So I wish the best to the vendors that actually get there, but in reality, the ones who resolve it have a really good way of being able to stitch this out a way that so Neil and I can actually benefit by just sitting back and seeing this work without us having to stitch it together.
Yeah. I'm curious, Neil, like from your lens, like, do you see this being part of the ecosystem of what's being developed today, or what should be developed today?
Yeah, no, I mean, I couldn't agree more. I think EHR integrated, alerts, EHR integration, I think is going to be really paramount to the next
Yeah.
level for really where language service really needs to go. Automatic routing for the right modality for the language would be, really incredible to see. Predictive analytics for different departments and modalities in terms of, time of day, preference that kind of goes through. That would be, something that would just help us get to there, make those connections a little bit faster, and then better dashboards, just so that we can have everything. And then within the emergency department, making sure that there's the AI integration between discharge planning and education materials. If everything is integrated into the EHR from start to finish, then you're going to have faster throughput, better communication with the patient, better communication through the providers and the care team, the nursing staff, the CT technologists and the X-ray technologists that go through. If everything is combined to one model and you've got AI integrated into that to help with the predictive analytics, I think that would really be next generation.